What's up, guys? Energy Physio. Last one on the Mythbuster for the month. We're talking about therapeutic exercise and strength and conditioning. Where do they fit in? There's a lot of kind of different ideas out there. I've worked in several different clinics with several different styles of clinicians. And so I've kind of seen the gamut of what goes on in a clinic, from manual therapy to therapeutic exercise only to modalities only. And a little more recently of a strength and conditioning style of rehab. And so we're going to talk a little bit about how those fit in, because I think kind of a misconception around rehab is that it's therapeutic exercise based. And while therapeutic exercise does have a place, it is not the one-stop shop or the catch-all for rehab, because there are a lot of other problems that can go on in the human body that require more than exercise. If you could exercise your way out of a problem, then it stands to reason that you could go to a personal trainer, a fitness instructor, anything like that, and solve your problem. But the way we need to think about this is strength is not a health problem, or lack of strength, rather. So we could say weakness is not a health problem. Weakness is a fitness problem. But when we start throwing pain into the mix and maybe some of these other problems, then weakness can start to play a role in how we rehab somebody. So when we're talking about therapeutic exercise, these are exercises designed to get certain muscles moving, certain muscles turned on, and certain muscles to come on at the time they should come on. And then when we talk about strength and conditioning, it's just like what you think. We're talking about strength and conditioning like we would see in any athletic program. And this is the breakdown. Therapeutic exercise 100% has a place and it works, but it can't work on its own. If you have a joint that's stuck, you need joint mobilizations to be able to unstick that joint. Joints are the gatekeepers to our muscles. So if a joint is off, the muscle flexibility and the muscle tension and timing are also going to be off. So we need some type of manual therapy around joints to restore joint mobility if that's needed. Muscles can also be just have a ton of overtension through them that require some type of neuromuscular reset to restore length and tension relationships. Also something that an exercise by itself is incapable of. And then on the tail end of that, once mobility is normal, stability and neuromuscular control are normal, now we can start to play a part in Therex and start retraining these muscles to work appropriately. Now we get into this idea of strength and conditioning. And this really fits in very well on the tail end of rehab, and it's going to bring about our next concept of load versus capacity and what that looks like in the rehab model. So when we talk about strength and conditioning, strong people have very resilient tissue, and that's so important in the recovery process, is restoring joint capacity, muscle capacity, movement-related performance, and then adding in a layer of strength and conditioning on top of that. So when our athletes and our patients go back to normal functional activity, sport-related activity, then we can start to rehab them straight through back to sport without risk of injury. So we got to stop thinking in terms of therapy is manual therapy, or therapy is therapeutic exercise on its own. In my opinion, it's certainly not modalities alone, because there's a lot that needs to happen other than just reducing pain. And so we need to start thinking about this as a multifaceted approach that includes both therapeutic exercise on top of joint restoration, muscle restoration, and then following that, start kind of diving into this avenue of strength and conditioning to make our patients more resilient and better suited to return to sport. See you later.